Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course.
Right?
Say no more, Bob.
My wife would actually sit down with you for 3 hours and talk to you about this. But okay, today, Brad, we're going to talk about how TENS can help your pain, neck pain, back pain, shoulder pain, knee pain. Basically, I don't know how you use a TENS unit, Brad, but when I have it with patients, mostly it's kind of a treatment of last resort.
Kind of, almost last resort. You know, there's some variations, but yeah, because the biggest thing is because even if they are successful, you still have to deal with the wires, and there's a bit of inconvenience that sometimes doesn't. So it doesn't know, you know.
Yeah, it's not an easy thing to use all the time. Although a lot of times you can just put this thing in your pocket, and the wires you can run up through the sleeves, and people won't even see it.
Sure.
They're pretty. They've you know, Brad and I have the benefit of age in this one. And I've been at this longer than Brad has actually. And I remember when TENS units first came out.
Sure.
And we actually had representatives. I was working at Mayo. Representatives come down from EMPI, and they were showing us this new thing. I mean, and back then, the pads were so terrible. You had to put your own gel on there, and you had to tape the pads on.
Oh my gosh!
It was just awful, and the machines were bigger, and
people don't care about that.
Okay, all right, let's go ahead. Let's start talking. So what we're going to do?
But wait, Bob.
Oh.
372 people just walked in.
In case you've made the mistake of clicking on our channel, well, you might as well make another mistake and subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, please go over to the Facebook and like us, because Brad and I, as children, were traumatized and not liked, and therefore we'd like you to turn that around for us.
We're catching up now, though.
All right, so today what we're going to use is a TENS unit from, I don't know, how do you say this, Brad? Ohuhu?
Yeah, O-H-U-H-U. And they call it a mini massager, which we don't quite understand yet. But we thought the price intrigued us, and the quality of it for the price is incredible.
Yeah, it's a really good price for
So we did more research, and we've been working with it, trying to see, you know, is it really going to do the job? And so far, it's passing everything with A pluses.
Yeah, our only criticism is the use of the mini massager, because it's not a massager, it's a TENS unit.
Sure.
And secondly, it doesn't go into the different modes. I want to talk a little bit about those today, Brad, because you're not going to know which mode you're on. I'm guessing which mode we're on, because we know things as high TENS and low TENS and burst.
Right.
And obviously I can feel those, but I can tell when I'm on one of them, but the average person's not going to know.
Right.
So, all right, so let's do this first off. What does a TENS unit do, Brad? So when you're getting pain,
I'm glad you're answering it.
I'm going to answer this, Brad. So when you get pain, let's say you hit your thumb. I'll put a big thumb right there.
Oh, and it hurts.
And you hit it with the hammer because you're like me and you don't know what you're doing. It sends a signal. I use a red for that.
Yeah, a little fiery red.
So it sends a signal all the way up through the nerves up into your brain. And that's why this guy looks sad.
Yeah, because it hurts.
This unit, what it does, it stimulates the A beta nerves.
Now you're going to get some eyes glassed over.
So these nerves actually, when you stimulate them, they inhibit the passing of this message.
Okay.
So it cuts it off.
So
it's called the gate theory.
Gate theory. I distinctly remember that in school.
So it cuts it off. There's just no pain. Now, my experience with TENS units is that generally, I don't know, maybe 40 to 50% of the people find it helpful.
Right. And I'd say about the same.
And some people really like it. Some people think it has no worth at all.
Right.
So if you buy one of these, understand that you might be one of the people that it doesn't help. I mean, it just doesn't make a difference.
Yeah.
But
I have an uncle. He's had some severe injuries from being electrocuted, and he's 87 years old, and he's been using for 20, 30 years.
Yeah. And they used to use them after surgeries sometimes, implanted. Remember when they used to implant them?
Yeah.
Yeah. So
I'm not that old, Bob, but I believe you.
So you know, there's definitely it definitely has some merit. The research shows that it works a little bit better on acute pain than chronic pain. But again, the big thing about this is really no side effects. You know, there's certain conditions we don't want you to use it on. We might as well go over those now.
Sure.
I got these written down to make sure. Pacemaker.
Right.
You don't want to do it over the carotid sinuses. You want to show where that is, Brad? Over the carotid.
Below the ear and the neck,
Yeah.
just stay away from there.
If you have a blood clot, you don't want to use it. If you're pregnant, I wouldn't use it over I wouldn't use it over the pelvis, trunk, low back, anywhere around by the baby.
Right, I'd just stay away from it.
Just stay away from it.
Use a cold pack.
Yeah. If you have decreased sensation, I wouldn't use it.
Right, good point. You've got neuropathy.
Right, good point. Skin irritation, open wounds, if you have a high fever, if you have an infectious disease. They said high blood pressure too. I'm not sure why on the machine it said that.
Oh, on the machine it did?
Yeah.
That's probably being pretty precautious.
On that one. Okay, so let's start off with this particular unit, Brad. You're not going to be able to see some of this because it's so small, but what this unit has is it has basically, well, maybe I could show it on here, Brad.
Oh, yes.
It has an M.
M, as in Mary?
As in mode.
Mode, yep.
It has a circle here, and then like this. And
for the control button.
Yeah, the control button. Then it has a T, and that's time. And over here, it's got a positive, and over here, it's got a negative.
Bob, I'm thinking if people are, 35 years or 40 years or younger, they're just going to figure this out.
Yeah, they're going to figure it out quicker than we are. But
right.
You start by pushing the M button. That's the mode button.
Sure.
And it's got 6 different pictures on there. And that's my other criticism of this. Mm-hmm. You've looked at these pictures, right, Brad?
Yeah.
You can't tell what these are. I mean, I have no idea what they have. One looks like a little kidney almost jumping around, and another is a brain, or I don't know. So you're just going to have to try the different modes, and then we can talk about which ones are which. But
right.
So you got the little machine. You're going to you get 2 sets of leads. All right, this is called a lead, and it goes into the bottom, right?
Yep.
Okay. And it's got 2 types of pads. It's got larger pads, it's got smaller pads.
Here's a small one.
There's a small one. Now the larger ones are going to be obviously for a larger area of the body. If you're doing like the calf muscle, maybe I'd use 2 small pads.
Right.
But if you're doing almost any other area, you could use one of the larger pads.
I've got them stuck on my arm right here.
Okay,
right
why
now.
don't you go ahead and hook yours up then, Brad?
Okay. Now the other thing is these pads are sticky and they're good pads. I'm impressed with them. However, if you are putting them on if you're a hairy person,
you gotta shave.
Yeah, you really need. It works much better when there's no hair.
You want to clean the skin actually. Probably put some alcohol on it.
Right, alcohol wipe.
And then the other thing is these pads. Don't share them between people. Mm-hmm. It's just like needles. And also, to prolong their life, a lot of times you just put a few drops of water on there, and it'll kind of revive them.
Yep.
And you can buy additional pads for these units.
Right.
So
online, Amazon.
Online, yeah.
Mm-hmm.
And we do everything on Amazon. So right now he's going to turn it on, which the switch is up here, and he flipped that on, and then he's going to hit the M mode.
Now, maybe we can. How is that, Lonnie? Can you? Oh, a little bit.
So then he's going to hit the M mode, which picks which mode.
Here's the M. I'm going to hit that. Now I'm on this second one. Now I went over this one. Looks like it has, to me, it looks like a stomach. And this one looks like maybe for headaches. This one has a little foot, and this one has an ear. Really don't know what those little pictures mean.
But what you're going to want to do is you're going to hit the mode, and then I want you to hit the intensity, which you only have to hit it like 1 or 2.
Right. So on the bottom bar here tells the intensity. There's only 1 bar there. I can barely feel it tingle. So this feels like pins and needles. Now you have to be careful that you don't go up too fast. If I hit the plus, you'll see the bar here. There are 2 bars. Now I have this on a trigger point on my muscle. That's why my muscle is.
Yeah, I was going to hold it, Brad.
And I should really move these, but it feels,
and then watch what his arm is doing. Can you see that, Lonnie?
Now it's pulsing.
Yeah. Now look, his hand is curling up like that. He didn't do that. You did it. I mean, the machine did that.
See, now if this is for pain, I would move these pads because I don't really want to have my muscles contract.
Right.
You know what I'm saying?
Yeah.
If I move this pad over here, I probably wouldn't get that. Why don't we turn it off? I'll do that quick.
Well, the other thing is, Brad, that you could do, if you went on a wider area, I think, I mean, you could use the smaller pads there, but...
Yeah, but I think that's an actual trigger point, isn't it? A muscle trigger point?
Yeah, it probably is.
Try it there. We'll see.
All right, I'm gonna let you turn it up because I don't want you screaming like
Yeah, I don't blame you. There.
a young girl or young boy.
Now, this mode is going on. Now, I've seen a lot of them where there will be a light that flickers.
There you go.
This is getting pretty strong. I'm amazed at how strong. See, I would probably turn this down because this is too strong for me. I'm going to go down. And I don't like this mode. It's ramping up really strong, and then it turns off.
That's why it's going to be really important for you to try the different modes on this.
Yeah.
I found mode number 1 was one of the more comfortable ones.
Okay.
I think that's what we used to call high tens, Brad. So that's a high frequency rate, and the high frequency rates tend to be more comfortable. And the low ones, the ones that are more uncomfortable, Brad, those tend to be the ones that, remember, this can naturally stimulate the opioids in your system.
Sure, yeah.
And the endogenous opioids. And
You've been doing your homework, Bob.
Yes, I have.
Yeah.
So the different settings will do different things. You have the gate theory, and then you have the opioids, and some of them might do both.
Sure.
Then there's the burst one. You felt that burst one, Brad, where it kind of, it's almost like gunfire.
Sure.
That also is for the opioids.
So you have to plan on spending not a lot of, you might spend 20 minutes to an hour going through different modes because the instruction book on this is not real detailed.
No, it's not.
It's $30. I guess they figure I don't know what they figure, but the quality of the tens, it's strong.
Yeah, again, Brad and I, again, because of our age, we recall when these units used to go for $1,000.
Right.
And even as of like 5 years ago, they were going for like 700. So, I mean, this to us is just amazing that you can get a unit for $30.
I mean, you can't buy pain pills that cheap,
Right. And the other thing is,
and there's no side effects on this.
right, no side effects. And the other thing is, what I really like about it is it recharges, Brad. Because remember, we always had to get batteries for the other ones. They always had the 9-volt batteries. I still got some up here, right here, the old ones that have the 9-volt batteries. So
You
it
can
charges.
plug this in your computer.
Yep, into your computer, or you got this piece right here that'll go right into the outlet.
Your 110, yep.
Yep, so it's just like a phone, charging a phone.
Well,
So-
what do you say? We'll give it an A or?
I give it an A, but I give it a C minus for instructions and for the description. It's not a massager.
Right, sure.
And oh, just real quickly, Brad.
Oh,
So pads. So
placement?
yeah, for placement. So again, like if you're doing your neck, you could try it on each side of the pane. If the pane is right here.
This is the back side.
Yeah.
That's why there's no face there.
So now let's say it's across the entire upper back. I would put 2 of them at a slant, Brad, like this.
Okay.
Now let's say you're having sciatica. I would put one on the top of the sciatica and then one down on the leg.
And the distance, sir, if you go really far apart, it may not be strong enough for that. You
Right.
just have to play with that and see how things go.
Calf muscles, I'd put 2 side by side. So you can put them, horizontal like this. You can put them at an angle like this, or you can put them side by side, vertical. So
Yep.
they always should be at least an inch apart.
Okay.
So.
Yep.
All right. Well, I think we spent enough time on this, Brad, but it is you're going to have to invest a little time in learning how to use it and which mode to use.
Right.
So-
Yeah, it's a complicated unit to go through everything in 10 minutes. So
Yeah.
we're doing our best.
All right. Thanks everybody for watching.
Be careful.